Another day, another visit to my amazing friend and bike fit extraordinaire, Burt. Today we're going to talk about common endurance, injuries and niggles and how you can prevent them. I just think it's very topical after doing the long ride that I did. I had a few little, not major things, but I know a lot of other people kind of complained of, it was like a very consistent thing of kind of what showed up doing long stuff. So I'm going to ask him his advice, get some tips on how to prevent it so we can all ride happily on endurance rides.
We're going to talk about the aches, pains or injuries that you get with endurance riding today, so really long cycling, and we're going to look at why they occur and what you can do about preventing or relieving them. Main ones are hand numbness over long rides, hot foot or numb foot, another contact point in the saddle, getting saddle sore, saddle pain, just because of the sustained amount of time you're sitting there. Non-contact ones would be neck pain. Most common reason why people give up on a race across America is they can't hold their head up anymore. It's mainly down to muscle fatigue, but neck pain and then the lower back. So we're going to look at these different ones. We're going to have a chat with Katie and say why they occur and what you can do about it.
I've never experienced numb hands before, but on All Points North, which was 1100k, I did have that, and they're still a little bit tingly like a couple of weeks later.
Your numbness is because you rode so fast. You don't get numb hands, do you, under 2, 3, 4 hour rides, all right? So if you get numb hands within an hour, then I would put that in a category. Something's not quite right about your setup. You've got too much weight, so your saddle might be too high, your front end might be too low, and therefore you're riding with quite a lot of weight on your hands. The numbness occurs because the radial and ulnar nerve come from here, and if you put in loads of weight because your foot position isn't optimal, you get that numbness. Yours is because you're literally riding for so long without much break, so they haven't got any chance to recover, then that starts to become an issue, and it's just the nature of those very, very long rides, and that's why on those though, you need to make sure everything's as optimal as you can, because quite often people won't get numb hands on 3-4 hour rides, but on really long rides they do, because on those 3-4 hour rides they get away with it almost, so maybe the position not being quite optimal, or not having double bar tape, or wearing, for example, gloves like these where you got a little pad there that protects you a little bit from there, things like that you can do.
So my gloves that I had were I've had them 4 years and they're completely flat, and I've only got single bar tape, so to prevent it, gloves and bar tape.
Yeah, and bar tape, you get the ones with like little bits of gel in that take vibration out the road, they can help. Double bar tape, as long as you're not worried about the weight, up here, you can just do it here rather than the drops you want. But double bar tape there also, not only is it more cushioning, but it actually changes the width of your grip. So that gives the hand a different rest as well. So a wider grip makes the hand a bit more relaxed, rather than, you're trying to grip something small like this, wider stuff. So double bar, even triple bar tape some people can use, And the big thing is that I think some people as well just spend all the time in the hoods, which is it's a great position, but frequent, if you're doing these really long hand rides, I think frequent change of hand position, remembering to come to the middle here, not just when you're climbing, So if you change your hand position frequently, you've got much less, just gives the tissue in the hand a chance to recover.
And what do you think about aero bars?
So aero bars you mean to give yourself a rest? Yeah. So we've talked about this before. I think putting aero bars on a road bike is a bit like putting lipstick on a pig, because the setup isn't really designed for it. But aero bars for endurance racing, just so you can go here and give your shoulders and your hands a rest, yes, I think they're right. But you don't set them up aero, you set them up for high for a really good resting position. It can help with the neck, the back, everything. So exactly. Yeah, I think they're good.
But the other thing with that is that you need to look at the other setup before you do that, because it might affect your saddle, it might affect other positions, so you can't just chuck them on. Because that's why I didn't put them on before that, because it was like, no, you need to get used to the position and get used to riding in that position.
I think you need to, remember, it's sort of like goal oriented. What are those things that don't talk about as aero bars and more arm pad rests, aren't they? And you're right, and it's getting used to riding that. When can you ride in them? Because obviously you don't want to descend in them and things like that, so you have to really think ahead. All right, this is a nice flat bit I can get onto here, so it's better. I mean, those people who do really long races they get that all really dialed in. They know where they're thinking about switching across and when they need a rest. So you're right, I wouldn't just shove them on. I think about, because when you go into those, your saddle, your rotation of your pelvis changes every slightly, so you have to make sure your saddle's comfortable at the front, so you can go in there. So as per usual, it's such a multi-factor area, isn't it? So
saddles and saddle pain.
So endurance saddle issues. So let's be clear about that. You don't get saddle pain ordinarily on your short normal rides 3-4 hours, but when you go endurance really, really long rides, you get saddle pain. Again, it's just sustained pressure that's occurring on the saddle, friction, and and the environmental conditions that the skin's having to cope with, on top of the friction pressure, for example, increased heat and sweat in your shorts. So that's why it's really important. If you're doing this long way, I would advise always carrying the weight of carrying a spare pair of shorts in case you get wet, or frequently changing them. It's so refreshing putting a dry pair of chamois on you if it's really hot.
When it was raining on All Points North, I didn't take a spare pair, but I took a pair of waterproof trousers over the top, because I knew Phil would say that that's how skin breakdown occurs. I was like, I don't want any saddle issues, so that's why I took something waterproof over the top, because I knew if I was going to get in mud off the road, or the rain on my bibs, it was going to cause more friction and just more pain. So
yeah,
I listened to your advice.
Good. You did.
Thanks.
And I think it's so we're talking again, friction pressure, helping skin out. It's frequent application of chamois cream, which I know you did, making sure that you've got the chamois cream quality there is the emollient quality. So making sure that your skin's being protected in that way. I helped plan a race across America attempt once, and we had pairs of bib shorts in fridges in the support vehicle, because it's so hot when they go across Kansas and literally they pull on imagine that nice cold dry pair of chamois. It's almost like refreshing to the skin.
Yeah.
Not everybody has a car behind them doing it, but you can imagine. The last thing is just making sure that that your saddle is the best saddle for you, and it's in the best place for you, and that might be worth investing in sometimes, just getting somebody to objectively look at that for you and help you out with it,
And also one thing that I did do, because I know Phil would recommend it, he always talks about the bike fit window. I actually adjusted the tilt of my saddle a little bit, because it was just so uphill. I was getting a little bit more pressure than I would normally get on, I guess, a more undulating ride, because it was all hilly. I felt like it was digging in more. Mm-hmm. So I just kind of tilted it down a little bit further.
Yeah, so the saddle, when you're going uphill, the saddle's almost coming back into you. So what you do is move it away, but tilt it. And further down, you're absolutely right. There's no one ideal position. There's a bike fit window, and hopefully by optimizing your position, you know where that window is. Yeah. And I think that's what you call micro adjusting. And some people micro adjust in a bad way. In other words, they're always fiddling and they're trying to solve a problem. That's different to micro adjusting, where you know your anchor point. You're just saying, I'm just going to change this a bit so it feels better. So a lot of people on those really long endurance rides will sometimes just move their saddle up or down 5 mil maybe if their knees are hurting, because it just works the quads in a different place, and that's fine as long as you know where your anchor point is. Yeah, exactly. Yeah.
Perfect. So
right.
Hot foot,
it's two things. One, it can be a burning pain and sometimes numbness, or both together. Again, if that occurs really quickly on ride, so you get in an hour and a half, 2 hours, it's probably you need to get that's something that's wrong with either your shoe insole or pedal or cleat setup. So I'll definitely have a look at that. Right, but feet come in loads of different shapes and sizes. Right, but the neural bundle here, that in between the big toe and the second toe, is the reason why a lot of people get the numbness, and they often say it starts there and it spreads to the rest of the foot, all right? Yeah. And it's because when you're pedaling, it's a forefoot sport and you're putting a lot of pressure there. So if you've got poor foot mechanics, that's where sometimes an insole will really help support the arch here, and a lot of them contain what they call a metatarsal button, which is metatarsal, posh word for toes. Basically, it's a button here that helps spread them. That can be incredibly effective. Even the off-the-shelf ones, we make fancy ones here. You can go to a podiatrist, but even off-the-shelf, off insole that's supporting the foot better can actually not. I would say in 75% of cases, we'll get rid of hot foot and people's pain. Yeah. Really? The caveat to that is that sometimes people have really wide forefoot, and that's why certain companies will make wider shoes. I think Shimano, Leg can make a wider shoe. If you've got the problem with that is that often when you have a wide forefoot here, you'll have what we call a low-forming midfoot. So people who go up a size find that they can't get the foot snug, but they have the width, but they can't get the foot supported rightly. So again, with the people with the wide feet, if you get a wide-fitting shoe, because if the shoe's too narrow and it's compressing, that will again jam up on here, and it means you get the hot foot. You had that.
I had that. I had some really, because I've got pretty wide feet, so I had laces and a really narrow shoe, and I used to get it not all the time, but like a lot of the time. So I ended up changing. I'll show you. I'll take these off. Yeah. But because I've got quite wide feet, if any of you have, I do recommend these ones. These because I like the boa.
That boa that's lower down, making sure that the shoe that you got, if you know, has those independent tightening points. So for some people, laces work really well because they can loosen off the lace down the bottom, at the top, but a boa's nice and fast. What's good about a boa system is, of course, and we'll come to the last reason, is again, with endurance, some things just happen. So you might never experience hot foot, numb foot, swelling or pain underneath 4 hours, but when you go for 8 hours, you get it. That's literally, your foot is the furthest place from your heart, all right? So if you ever remember, you've been on your feet all day and you take your socks off and you see that little ring, that's what we call dependent edema. It's the fluid that sits outside the cells. So basically, because it's at the bottom, the pressure pushes the fluid out and the circulation can't get it back, And when you put your feet up and rest at night, it all goes away, all right? Obviously cycling, you're right down at the bottom here, your foot just, so you can get hot foot, but your feet swell quite significantly, especially when it's hot. So loosening your shoes off. I think you did
I've done that, just because I just loosen the bow as I'm riding, so it's easy to do.
So if you feel your feet going a bit numb or tingly on long rides, just loosen off your shoe a little bit, and if it goes away, that's the reason. You might argue using compression socks, if it's a real problem, could help out, because that will keep the fluid in and help it retain above it. But that's the most common reasons why people get hot foot. My big tip is that if you're ever worried about your cleat position, remember, is just that if you think about it, just move your cleat as far back as possible. I can't think of a negative reason to do that. It helps out the knee. No performance, but what that will do is take the pressure behind the big toe.
The pressure point.
Yeah, it just takes it behind the big toe. And for some people, literally moving the cleat back will solve that. Even changing the insole of the shoe will change it. So that's something quick and easy to try. And it might be that you don't need to do that on shorter rides, but for long rides, the rearward cleat position just helps you manage that issue coming on.
We have to talk about Achilles because I had this just doing loads of hilly stuff. My Achilles did not like it last year.
You said a lot of people comment on Achilles, don't you? And I've seen a bit more of it. So classically, cycling is a great sport for anybody with an Achilles injury because it has no eccentric forces. There's not much demand on the Achilles in cycling because below your knee, remember, we don't produce any power, we're just transferring power. So the job of your calf, ankle and foot is to transfer the power into the pedal, right? So in other words, don't deform too much, all right? On normal rides, you'll maintain your calf will keep your pedaling posture good, but then when the calf starts to fatigue, and of course drops. If you do lot of climbing, we tend to drop our heels when we're climbing because you drop more like that, then you basically start to wear the Achilles, load up the Achilles more and more and more. And I would say I'd be very surprised if anyone tore their Achilles, but nearly all Achilles problems aren't like actual Achilles tears. They're the dramatic ones in athletics and stuff. But
because they're explosive.
Exactly.
Whereas cycling is more just of a constant niggle on it, like the constant strain.
Better put than me, well done. Because they're explosive. But
I know, I felt it.
What we tend to do is get overuse, and those things that overuse is fluid around the tendon, peritendinitis.
It's like creaky. That's like the
and painful. The good news is that if you can get through the event and then rest it and rehabilitate it properly, it'll almost certainly go away. But
icing, like ice on that.
Ice, get some professional advice. Do make sure the tendon recovers well. Do the eccentric exercises. Just a good recovery afterwards.
So one thing that Phil did for me, because basically what you're saying is when you get tired, your heel drops and it's just more pressure. And on top of that, if you're doing loads of hills like I was doing, it's just extra strain.
Extra strain.
So I'll show you my shoe again. I've got these little rubber. You see that? What would you call them? Just like basically cuts that you
heel raisers. You can get any chemist will get a heel raise, and quite often people who are recovering from Achilles issues will put a heel raise in because it just basically shortens the Achilles and therefore it's not extended as far. So we made this little custom intervention for you.
So I put that in.
One thing to be aware of with that, and we did check it out just for people out there, is obviously if you're raising the foot in the back of the shoes to make sure it's not pushing you out the shoe too much. And then what you don't want is the Achilles heel coming down too low and they're irritating. So some people get Achilles problems here just because this cup of the shoe can be too
tight.
It's just not right for them. It can be too close. I've never suffered with it, but I've seen people who will cut these away just because they don't like.
That's good to know. If you're going to use the heel raisers, make sure that it's not actually pinching the back of your
It's not pushing your Achilles too far out. It wouldn't be. It'd be hard to. I think you'd have to use a lot, but just be aware of it. And the last things I was talking about was the neck and the lower back, wasn't it?
Yes.
Now, if you get neck pain, lower back pain again very quickly on the bike, then you've probably got too low a front end or too high a saddle. We both the same. But in other words, you're putting too much pressure down there, so you have to creak your neck. But on the long rides, and like we mentioned, Race Across America at the beginning, is it literally the muscles here that have to hold your head up to look down the road start to just give up, because they're not used to being in that position. Now, it's really hard to train them for that unless you do those really long rides all the time and get them stronger. So I don't really know if you can condition them by doing as long as rides as you possibly can to get you ready for that but not many people do Race Across America to train across America.
No.
Right. The same with the lower back, it's just the sustained flex position. What I would say around this is you have to make sure your your bike setup is optimal for that long ride. So what's right for 3-4 hours might not be the position for 11-12 hours. In other words, I would
make it less aggressive.
Exactly,
maybe.
make it less aggressive. Aero goes out the window. It's just power and sustainability, comfort. So it might be that the front end is more relaxed front end.
You can get like razor stems, can't you? You've mentioned before.
Yeah,
you can get razor stems that can lift it higher.
The arm pan position that you talked about, and I think it's just having that optimal saddle that allows you to, your back to sit in the right position. A big no-no for me I've always talked about nose up, saddle nose up. It's the most common reason for low back pain. You say if that saddle is ever so slightly nose up, then the back has to do even more flexion.
Like knee pain. Actually, I had a little bit of knee pain when I finished all points off. Like, keep going on about half off. But I was on.
Rightly so. It's an amazing achievement.
Thanks. But yeah, at the end, I've never had knee pain ever. And at the end, it was a little bit swollen. Actually, it's a little bit sore, but not like crazy sore.
So again, it's just. These events are so long. It's just an overuse injury where the knees just get at its point where it can't cope with anymore. It doesn't mean you're wrong. Doesn't mean the bike's wrong, right?
Yeah.
That's where I think you just need all things as good as possible. This is adjustable. You're adaptable.
Yeah.
We want to make. I often say to people, "There's no bad positions. There's better positions." Right? And you go everything about that working with you. So the big thing for me on those really long endurance things would be just probably looking at the shortest crank that's right for you, because why would you want your knee doing more up and down, more movement over 11? How it took you 3 days, didn't it? Yeah. So 3 days. If I said to you 3 days, right, your knee has to go from here to here to here to here, or it can go from here to here to here. That's going to be less work. I think what these endurance events do is they just find your weak spots, which we all, but your body can cope with that. Maybe lower, more explosive rides and stuff like that. We have all our coping mechanisms, our ways of doing things. So we often talk about in biomechanics called preferred movement pathway, which I really like. Like you don't pedal the way I pedal, or anyone else out there, but you have your now some of those movement pathways. For example, Rafa Nadal and Federer, they are brilliant at playing tennis. Their movement, mine is terrible, right? Yeah. When we go longer and longer, we find out which are the more efficient movement pathways. So the way you ride the bike gets uncovered, as it were, and then we find your weak point. So that's when you made a point at the beginning. If you get problems straight away, it's either your setup's wrong or you're taking a problem onto the bike. We've all got history with our bodies, so a lot of people out there will be thinking, I want to do this really long race, but I know I've got a problematic knee or an cartilage damage from football, rugby, whatever. That riding might fight. Even though cycling's brilliant for knees, it is the most common injury because it's the joint that's out in the wind, sort of thing.
So how would I prevent that then?
I think if you're going to do really long races, again, making sure you've got the absolute optimal shoe, insole, pedal system for you, cleat setup, all that, making sure that's helping the knee out. I think another thing is you're going into the event in the best possible state.
So like gym stuff?
Yeah, so basically, if you start at all points north with a really tight quad, it's probably going to end up in knee pain, isn't it?
Yeah.
So you start as good as you possibly can. So muscles in the right range, as good a loose as you can be, sort of thing, and as conditioned as you can be. The most common thing is when people break down these events is you always see it all the time in sports medicine. They're either overcooked themselves before or they're underprepared. In other words, they're trying to do it and they haven't done enough for the prep work. The people who get through these things, they always sit on the start line. If you can ask yourself the question, have I done everything? Have I done everything I can do to get rid of this? If you say yes, get on with it.
If they've got any questions, anything else that we've not covered, let us know in the comments. And I'll leave Phil's YouTube channel below. Go and subscribe. And thank you very much for your expertise. And also thank you for replying to my messages. I messaged him at midnight and I was like, a few hours later, it's like, no, I think you'll be fine. Then I spoke to him, so thank you. All right. See you all next video. All right.
You did. You were brilliant.
Aw, thanks.
I nearly texted you that night before you texted. Have you done it? I said send me a photo. You never did, you fucker, did you? Are you hypermobile?
Yeah.
That's like you flip them around, isn't it?
Yeah,
look. Oh my God. I've never noticed that about you. Stop it. It's really making me feel sick.